Hi, my name is Renee Lochran. I am the Franklin General Hospital Employee Health and Education Nurse. And recently I have been very involved in the COVID-19 vaccination process. And as of today, I would say we probably have close to over 100 employees vaccinated at this time, fully effective with their second dose. So I would like to take this time to kind of share some of our experiences with you. And I understand that you guys have a few questions that you were concerned with, and I want to go over those with you. So the first one I have is, how safe is the vaccine? The vaccine goes through clinical trials to test its safety and effectiveness by the FDA. It goes through 4 stages during the clinical trials, and each one of those stages have passed the trials by the FDA and therefore approved by the FDA in late December of 2020. So it's been safe. How do we know about the possible long-term effects? Both the FDA, Pfizer, and Moderna vaccines are highly effective in preventing COVID-19 with no serious side effects. However, many people who have received the vaccine report moderate to flu-like symptoms after receiving the vaccine. Keep in mind, these reactions are temporary and self-resolving within a few days. Serious reactions are rare with the vaccine. Is there any recommendation for time off after receiving the vaccine? This would be up to your employer. I can tell you from what we have seen is probably about 50% of you will experience mild to moderate reactions in at least one of the 2 doses you receive. My best advice is to make sure you have a backup plan just in case you experience moderate symptoms or side effects. And although many of our staff have returned to work the next day with minimal to no side effects. If you've already had COVID-19, would it benefit you to receive the vaccine? Yes, it would benefit you to receive the vaccine. Although they say you have antibodies for the next 90 days, it is not guaranteed how long they will last. And if you are exposed, again, if you have enough to fight off another infection. Is there a waiting period to receive the vaccine if you've already had COVID-19? I would not get the vaccine if you're sick. You need to make sure you're healthy enough to receive the vaccine. You also do not want to receive the vaccine if you've had the BAM or convalescent plasma previously, if you were already sick with COVID-19. It has been experienced with some individuals that have previously had COVID-19 do experience a few more side effects of the vaccine. Again, it's moderate flu-like symptoms, but most often everybody has a full recovery. Are there any conditions under which health professionals recommend individuals do not get the vaccine? Yes, you will want to check with your provider if you are taking steroids, antibiotics, or any autoimmune medications. You also want to be sure you are free from any type of infection before you receive the vaccine. Are there any side effect issues with receiving the vaccine if you're pregnant? I would advise you to speak with your healthcare professional and discuss the risks and benefits prior to receiving the vaccine if you're pregnant. If your provider decides that it would benefit you to receive the vaccine, you'd want to monitor your temperature and report anything above 103 to provider. Should individuals who are breastfeeding receive the vaccine? What are the risks, if any, to the baby? Again, I would discuss this with your healthcare professional to ensure mom and baby are carefully monitored during this time. Every situation is different, and we want to make sure mother and baby are healthy enough to receive the vaccine. I most often have a localized reaction when I receive my flu vaccine, such as swelling, heat at the injection site. Should I be concerned about more severe reactions to the vaccine? More than likely, you will have the same reaction. It's very common to have redness, heat, swelling, and for the injection site to be tender. You can take over-the-counter medications such as Tylenol, Benadryl, and Pepcid to help with your pain, comfort, and inflammation. How does the vaccine affect someone with medication and food allergies? I would consult with your provider to assure it's appropriate. You are able to receive the vaccine if you have a history of severe reactions. The vaccine is only contraindicated if you have a history of anaphylactic reactions in the past. Those are the questions that we have received. Hopefully we have helped answer some of your questions. Just to let you know, our clinics have gone very well. Our staff have been feeling really good. We hear a lot of compliments of how they feel completed and they're ready and they're glad they did it. They always say they'll do it again if they have to, rather than having COVID. Even the ones that have had COVID before in the past, they would definitely take the vaccine over having COVID again. I'm sure some of you are very concerned about the symptoms and the side effects that you've had after receiving the vaccine if you decide to choose to do it. What we have seen is your arm will be tender to touch at the site. Redness and swelling is common. Pain and tenderness. Once in a while, somebody will have more moderate flu-like symptoms such as achiness. They might run a fever or just generalized local just body aches. Again, those can be comforted with Tylenol around the clock. You can take Pepcid and Benadryl. I know Pepcid sounds really odd because it's most often for your GI system, but it does help with allergic reactions and the inflammatory process. So I would encourage you to take that too and follow everything as directed on the package. So those are kind of our experiences that we've had here. Again, everybody said they would do it again. We had no severe reactions. Everything has gone really well. So we hope that you decide to get the vaccine because to help prevent the spread of infection. Thank you.